The Sepsis Academy is a Methodist North Hospital skilled nursing facility collaborative funded under a grant contract with the state of Tennessee. So, what's the big deal about sepsis? According to the Centers for Disease Control and Prevention, sepsis is the body's extreme response to infection. It is a life-threatening medical emergency. Without timely treatment, sepsis can rapidly lead to tissue damage, organ failure, and death. Residents living in skilled or long-term care facilities are at risk of developing sepsis because they are at higher risk of contracting an infection, and many suffer from chronic illness or weakened or impaired immune systems. The risk of death from sepsis increases by as much as 8% for every hour that treatment is delayed, and as many as 80% of sepsis deaths could be prevented with rapid diagnosis and treatment. Sepsis is a medical emergency, and its symptoms must be treated quickly and properly to reduce the risk of death. Any type of infection can cause sepsis, but the most common infections that trigger sepsis are also common among residents living in skilled or long-term care facilities: pneumonia and urinary tract infections, or UTIs. Not all infections are sepsis, but all sepsis starts with an infection. Identifying sepsis early is key to survival. Fever is often the first manifestation of sepsis. Abnormal lab values may also be a sign of sepsis. There are signs we can look for that don't include lab work, such as altered mental status, confusion, depression, sleepiness, or difficult to arouse, cold, shivering, fever, sweating, pain or discomfort, difficulty breathing or shortness of breath, fast heart rate, the patient doesn't look right or complains that they don't feel right, and decreased urinary output. Any resident living in a skilled or long-term care facility with 2 or more systemic inflammatory response syndrome or SIRS and a suspected infective source is deemed to have sepsis and needs further screening. SIRS is identified as temperature greater than 100.4 degrees Fahrenheit or 38 degrees Celsius, or less than 96.8 degrees Fahrenheit or 36 degrees Celsius. Pulse greater than 90 beats per minute. Respiratory rate greater than 20. And white blood cell count greater than 12,000 or less than 4,000. Early detection and prevention are essential in the fight to stop sepsis among residents living in skilled or long-term care facilities. The top preventive measures skilled or long-term care facility staff can take include good hand washing, assisting patients with daily bathing to keep the skin clean, and getting vaccinated to help prevent infection. Only you can help by following these preventative measures and keeping an eye out for the early signs of possible sepsis development. For more information or to join the Sepsis Academy project team, contact the Methodist North Hospital Skilled Nursing Facility Collaborative at 901-516-5800 or send an email to one of the addresses listed below. The Sepsis Academy is a Methodist North Hospital Skilled Nursing Facility Collaborative funded under a grant contract with the state of Tennessee. This project was made possible through the efforts of Grant Administrator Dr. Elizabeth Jones and Grant Coordinators Sandra Freeman and Elizabeth Hartz.